Welcome, ladies and gentlemen, in the representation of the state of Hesse in Brussels, where I say hello. For a crisis talk, we have health data protection in research and data security. This is organized by the Ministry of Hesse for European Affairs, together with the Leibniz Forschungsverbund and normative orders of the University of Frankfurt.
Please change to your English channel. Bevor wir aber nun beginnen mit der Diskussion.
But before we start with the discussion, we have Mr. Weinmeister who will talk to us. I welcome you to another interesting meeting in the representation of Hesse, and I'm very happy that you have interest in this topic, that you are interested. And it's a topic that right now in the pandemic is very important. We are also talking about data sovereignty and how can we treat data in the right manner so that it can be used also for the research. And I'm very happy to have Mr. Axel Voss here today with us, Frau Grigor, Mrs. Spiecker, and Mrs. Schulten. And they will talk about this topic. We are talking about data in the health service. It's a classical sovereignty because everybody owns his own data, but we have also the necessity in the health service to be able to use this data in order to have the best data and also use them for research. And therefore it is important that we talk about this, and therefore we have here Miss Professor Deitelhoff is here together with us for the crisis talk, and I think we have to have a further look because we have the interest that we as human beings in our decisions, especially as far as health is concerned, and we will see what has to be considered as far as our data is concerned. And therefore we also had, we are on the side of these who are able to give their data, but they are not obliged to do so. And therefore we need to have clear rules for the future, and we also know exactly that this data are needed in therapy, and also if we want to compare them to other factors in the health sector, which is not easy, and therefore it is very interesting to hear and see what the single participants here have to say. And I'm looking forward to a very interesting discussion, and that we can also discuss all these topics. We will also hear a lot of questions, and therefore I hope you will have an interesting meeting here. Stay safe. Thank you very much to Wiesbaden. Mr. Kroll from the Leibniz Institute has sent us a video. Dear Minister Puttrich, dear Mr. Voss, dear Mrs. Grigor, dear Mrs. Speaker, I'm very happy to be here, Crisis in a Common World, to welcome you in another discussion. This is the 18th crisis talk day that we organized together with the representation of Hesse, and thank you once again for having us. And also together with the University of Frankfurt. Last week we had the opportunity to talk about the crisis management, 10 years of cooperation. This was, we had different professors, Mrs. Deitelhoff in and Mr. Mehling. And we have seen that the crisis in the EU is not only a chance in order to have new projects in a certain way. Is this also the topic of our topic today? Because we want the safety of all people due to Corona, and it is important to have the citizens on our side, and we will for sure talk about this. There are also risks and problems that come up, and this is something that is in the hand of science, and we are very happy to have Mrs. Spiecker here to talk with us about all these topics, and also to allow our citizens to decide what they want to do with their data. I'm very happy, therefore, to have a very interesting talk. I'm very happy that I have the word back, but I will give the word immediately to Mrs. Speaker, and I would like ask our viewers, streamline at LV, Hessen.de, or you call 0032 0472 030181. Mrs. Speaker is professor for right and is concentrating on information right. And now we will hear what you have to tell us. I'm very happy to be here and to talk to all our viewers. And this is something that I like very much. We are talking about a conflict between the data protection, and at the end I will show you why this is not so huge. We have researched this is something clear, and the pandemic showed us how important this is for us. But digitalization leads to another kind of research as what we have had up to now. The pandemic and the digitalization show interest in this data, and this data are not connected to health or to a crisis. Researchers would like to use data, and they do this in a framework that is quite complex. You have said which parts are involved here. I would only concentrate on data protection rights, and after this I will protect you new center, the Digital Health Care Act, and then the GDPR, and then I will talk about the two, and then have also a discussion. Now, the DSGVO is there since 3 years, the GDPR, and we have different mechanisms that have been changed. The goals, and this is very important in our topic, is that we have imbalances that single people might abuse, and we shouldn't also have any chilling effects that you can't use your rights, and this would obviously affect us. And then we have also the principle of to be careful. Now, this framework foresees that we can elaborate data. It's not avoided, and we have some basic laws how this can be done. First of all, the use of it, or what are my data used for, because then you have also the use of this data for other fields. And we have here Article 9, and we can see you can accept, as far as the research in data is concerned, or data in general. I would tell you, in the pandemic, we couldn't use the data. This is not true, because we do have our basis for this, and the member states and the European Union can, for research requests, create this basis. In Germany, on this basis, we had the Digital Healthcare Act, and 90% of the German people are involved in this. And a part of telemedicine or apps, we have a center of research data. All data are included here, are centralized. And there is almost no limit, apart from the fact that this should be open to research centers. Now, we also have the law where we can allow data, and we should have done this better. Now, what could be the conflict with this data? And if you look at it, it's not that much, because normally research is something very special and that there is a space for it. But this privilege that I have in different laws is not completely clear, and therefore we have to see what can we protect as far as research. Our highest court is all that is useful to find truth, and this is similar in the EU Charter in Article 13. It's only related to research. We can also use it for teaching, and in the context we can see that this context is restricted. We do a big use for the common people, for the whole country, for the health service, and this is an exchange. We have one. It doesn't mean we have one winner and one loser. Both of them have to be in balance, and this should be done with rulings of the member states in Article 8 and 9 for the data and for the research, because we have security measures and can use this field. But you should never forget why we are restrictive here, because data have different, can't be recalled. Once you use the data, they can't come back. And we have international interest. We have seen it in Corona. Not all of them did it in the right way, and we should keep this on track. Now, what does this mean for the research with data? You can do that with the GDPR, and it is something we wish, but it is limited. This means we have different uses, and we can't give these data to anybody else, to something we do not know enough about, and therefore we need a clear ruling on how to use this data, and we can see it now in artificial intelligence, because all this is dominated by those who can access data and can exclude other persons. Therefore, we do need also a participation at the results, and that requests data management, and there we are lacking all behind in the European Union. Could certainly do an important step, like in artificial intelligence and in data protection. Now, I would close all this. We often hear, all do this, all do it, is not a really good rule, but an opening for the interests of others. Thank you very much for your attention. Thank you very much, Mrs. Speaker. Here we have Mr. Axel Voss. He is member in the European Parliament for the CDU, for the German party. And we have Yiannos Tolias from the European Commission in GD Health and food security.
Right now, a lot of things are happening at the European Commission in the realm of health data. And you have a consultation running, and there are supposedly legislative proposals in the pipeline. What changes are there to expect for the European citizen?
Yes, thanks a lot for the introductions and the presentations before. Indeed, can you hear me well? Yeah.
Yes, we can hear you very.
Yeah,
I can hear you very well. Please go ahead.
Yeah, the idea is also noted at the beginning that at the moment we have abundance of health data in the EU, but around the world, I would say. And this abundance of health data, they create a great potential to transform healthcare. In addition to also be used for transforming healthcare, we see that this data could be having impacts on fundamental EU freedoms. In other words, and here I'm referring, for example, to the freedom of free movement of citizens, free movement of services, recipients of services, and as well as implications on the GDPR. So this is I would say, the background of why it was also considered necessary to create at EU level what we call the European health data space, whereby these issues could be more organized and data could be further organized in a secure environment, in an infrastructure which is common to everyone, having certain quality of data, interoperability of data, GDPR compliant. So it will basically safeguard and secure the data, how they are moving around. And if I may say another couple of lines at this first contribution, and this data could be seen in they could be used for two different purposes. The first one, it would be what we refer as the primary use of data, and the second one, it will be the secondary use of data. And the European Health Data Space and the legislative initiative that you refer to, it aims to tackle both challenges and provide solutions to both issues. When it comes to primary use of data, we are mainly referring to data that are used by citizens or by patients for their primary care. And these data, of course, could be used when they are cross-bordering, exercising their free movement, or when they want to receive services, or if you're a healthcare professional, want to provide services, and you need this data to be able to carry out that service. And the secondary use of data, which is another big part of the legislative initiative, as you have also seen in the public consultation, which is running, it deals with the use of data in, if I may refer to a concrete example, in developing, for example, artificial intelligence. How you could access data, how you should ensure diversity of data. And here, maybe there is time later to also connect it and discuss more, connecting it with the proposed regulation on AI, which also refers to the data quality of how you should ensure the trustworthiness of AI systems. So that's a bit a short introduction of the European Health Data Space.
Vielen Dank. Thank you very much. Herr Voss, ich frage Sie.
Mr. Voss, I ask you, why does the European Union, a European data room, let's say, well, we do need something like this because otherwise we wouldn't have it. And I consider it a miracle when we have a radiology result that is coming from Austria here or to Germany. And I say we need to tackle with that. The room of health data is so huge, and I can't imagine that this will be coming on its own. We need to foster it. We need to have a framework for it, because this segment contains so many things as far as different questions are concerned, health and rights, and we should have some help from politics there. Mrs. Speaker, you already talked about the framework conditions. The latest since the pandemic, we do know that the European Union has limited competencies. How can the European Union do anything in this context? Can we have a law? Well, I need to say the European Union has limited competencies, and therefore we have still free rooms. And obviously healthcare is one of these fields, and this is a social insurance right. And there the member states want to keep and stick to what they always had. Well, the health data space is something we can rule. Your example is really a bad example, because this is something we can do this, that from my German medical doctor, it goes to my German doctor. There might be some problems. It's only because we are not used to have cross-border health systems, and obviously this is forced now in order to have the exchange of the materialities. And obviously there are also rules from in the commercial field like AI, and we do have competencies under which we can build up and where we can find a conglomerate institution. We can't probably go into a social security, but that might be right.
Secondary use of the data. Maybe you could become a bit more concrete what you're planning, or like what the Commission is planning to legislate, and in which areas something for a European citizen will actually change.
Sorry, can you repeat the question?
Yes.
I have a bit of a problem to hear the question.
Okay, I'll repeat. So you mentioned two areas of data, or the use of data. There was the primary and the secondary use. And I understand that the primary use would be the area where things for the European citizen would actually change. So let's say in 5 years with the European Health Data Room, what would change for me as a European citizen?
Yes, that's a good question. Indeed, the primary use of data would be very much dealing with providing primary data to be used for the personal health care of the citizen. And to provide maybe a few concrete examples to see what is the ideas which are floating and still, of course, at brainstorming stage, is that indeed you may, and we have seen that one, for example, at the moment that especially after COVID, we have a number of teleconsultations taking place. Now, of course, this is something which started during COVID. It was upscaled, and it seems that it's moving and is used more and more often. The idea there, a more concrete example, would be if you are an EU citizen, let's say, living in a small village somewhere, without having an expert healthcare professional for that specialization in that field. And you would be able, through maybe teleconsultation, or as we see technologies developing through maybe telemonitoring, if you, for example, you're telemonitored remotely from another country, and you are also talking and consulting a specialist in another country, and all this data that they are collected from you through this monitoring device, for example, could be transferred to the other country where they would be analyzed in the special center, let's say in a big city, in a big capital. They would be analyzed. You would be having the teleconsultations with the physicians, and you would be able to also transfer all your data in your electronic health record, because that's another idea of digitizing the data in an electronic health record. You would be able to transfer them to that hospital of your choice and that physician of your choice, and then which it shows that it would be giving a wider choice to the citizens to be consulting, be monitored elsewhere except that in that little village, let's say, that they're living, everywhere in Europe, and using all these facilities. So that would be, I would say, a concrete example of how the citizen would be able to, if I were to put it in legal EU terms, will be able to receive medical services from elsewhere in Europe and choose what is the best medical place or healthcare professional to receive these services.
Also in gewisser Weise wäre ja.
This means the problem you were talking about, Mr. Voss, should be then, like, let's say, acceptable for all. Yes, but we need a ruling, because otherwise we lose our future. Whatever we say or what we do, it's more than 1 billion. Probably they have access to all the health data. If we look at the US, we do not have a GDPR, but where the big companies can have access to data, already have them or get more in the future. And then we will see that in our fragmented world we can't proceed. And the example that has been criticized is good because it shows us what we do with our GDPR. In theory, it's nice, but as soon as somebody says, oh, there we have problems with the data, if it is true or not is another question, but the mentality behind that and the interpretation that we have, especially in Germany, is so restrictive that the other elements that we should keep track of are not mentioned anymore. Climate protection, environmental protection, security, all this is now in data protection without having a balance. And I guess this is the wrong way. Mrs. Spiecker, I could imagine that you might add something to this. And I also have a question from Mr. Peters, expert for cooperation in Europe and is working for the European Commission. And he is asking, I reassume it, that especially in Germany, there are always problems to use health data, and would like to know what is possible and what not. Does as always, I have to say, it's all too general, but it's really a very important point. I do see and understand that in the GDPR and some points there are still difficulties, and I wouldn't say that the GDPR is something huge. It is written on it, but it's not inside. And the citizens do know if something is just told and if they receive the service or not. And I guess that the citizens would like to have it easier, that we have services in different countries. And the health sector, this is not related to data protection. Normally, it is because it's the social protection, the social security we have systems in the European Union that are better than others, and these kind of tourism, some countries wouldn't miss it and other countries wouldn't like to introduce it, and others would like to have better rulings because this is technique neutral. There are no rulings, but in the health sector we do have a lot of rulings, and I come back to Mr. Peters. Cooperation is a topic that is not clear yet. Also in other fields we do not have a cooperation right. So if the European Union want to do something, then in this topic, if we have two clinics, one in Vienna, one in France and one in Germany, if you even have to exchange data with New York and Wuhan, and you have difficulties, but try to see it from the taxpayer's point. If there are any assets, we do need to find solution, but the solution can't be we free everything, and the solution is, what I wanted to say is, we need clear borders, because these borders offer acceptancy, and this is something where citizens react. They are confident that their data are safe, but a system where you say it's data protection and then whoever can access, this is something very difficult. And when we learned one thing from the pandemic, then that we need to take the citizens on our side. Mr. Peters would also like to know if in Germany, if at the lower level there are health data, because it's the higher level, at the federal level, at the regional level. Do you know if in smaller places there are health data? Yes, obviously, but you have to look what you want to know. First of all, obviously, every medical doctor has health data of the patients and of the different fields. And therefore, I go back to what I already said. It depends. The data are there, and very often I can harmonize them. I can put them into a pool, and this is important and good for research, and then I have another level.
So before we go to the second use of data, which I think might be very interesting for a lot of people listening, I would like to ask Mr. Tolias, when can people expect the new proposal for regulation, I think it is?
Yes, now, as you have noted, we are at the stage of the public consultation, which will be ending soon. We are also carrying a number of studies and a number of other consultations and impact assessment, of course, like the normal rules that need to be followed. I would say the first proposal should be expected beginning of 2022.
Okay, thank you very much. Herr Voss, Sie haben ja schon die Datenschutzgrundverordnung angesprochen. Es hörte sich ein wenig so an, als würden Sie die Datenschutzgrundverordnung für einen Hemmschuh halten. Meinen Sie, dass es Änderungen geben muss an der Datenschutzgrundverordnung im Zusammenhang mit dem europäischen Gesundheitsdatenraum?
Also sie braucht grundsätzlich Anpassungen, weil ich sie eben heute nicht mehr als technologisch neutral ansehen würde, aufgrund von künstlicher Intelligenz, Text- und Data Mining, Blockchain, wo man all diese ganzen personenbezogenen Daten vielleicht, wenn auch zufällig, irgendwo mit integriert und dann auf einmal nicht mehr rechtmäßig ist. Im Gesundheitsraum, glaube ich, zusätzlich, obwohl es die theoretischen Möglichkeiten gibt, wird davon viel zu wenig Gebrauch gemacht. Und deshalb, glaube ich, müssen wir auch da höchstwahrscheinlich klarer werden in der Anwendungsfrage und uns aber auch mal mit der Frage beschäftigen, soll eine allgemeine Gesundheit in dem Fall über Forschung, Wissenschaft etc. Soll das durch Datenschutz und die Auflagen, die dort mit existieren, tatsächlich erschwert sein oder nicht? Weil ich glaube, wenn man Krebs bekämpfen kann oder Alzheimer bekämpfen kann, wäre das ein Benefit für alle Beteiligten. Natürlich wollen wir das Individualrechtliche nicht völlig beiseite schieben, aber es gibt kreative Möglichkeiten, dennoch mit Daten umzugehen, wenn man es denn auch mal zulässt. Das ist ein politisches Problem, weil es eine stereotype Verhaltensweise gibt, gar nicht erst kreativ darüber nachzudenken, weil es einfacher ist zu sagen, nein, Datenschutzprobleme, wir machen das mal nicht. Und deshalb, das kritisiere ich, und ich muss eben auch sagen, eine Datenschutzgrundverordnung kann, wo wir jetzt 3 Jahre in der Anwendung sind, durchaus das aufnehmen, was zu Problemen führt und man sie auch verbessern kann, auch im Sinne von weiteren Beschreibungen, wo Grenzziehungen stattfinden. Und das ist etwas, was ich kritisieren muss. Letztlich muss man irgendwann zu dem Punkt kommen, dass Datenschutzbehörden eigentlich auch Teil einer Wettbewerbsbehörde sein müssten, damit man die unterschiedlichen Interessen, die sich mittlerweile bei der Bedeutung von Daten wiederfinden, irgendwie dem auch gerecht wird. Das Datum aus den 80er Jahren unterlag eben nur dem Grundrecht. Heute kommen wir eben zu Fragen, können wir überhaupt noch Klimaschutz betreiben, wenn alle in einem Gebäude durch irgendwie Technik und man Profile herstellen könnte, obwohl es keiner will, aber wo man das sehen will, ob es da nicht irgendwie, also Datenschutz ist genauso in Bezug auf Gesundheitsschutz. Wir haben eine Warn-App oder auch den elektronischen Impfpass, zumindest in Deutschland, immer nur unter dieser Rubrik Datenschutz subsumiert. Wir haben niemals gesagt, wie kann ich denn meine Pandemie am besten managen, weil das ja wie ein Krieg ist.
How will I be able to manage this? Nobody had this idea. And I think this is unbalanced, and therefore we have to ask the question in a more intensive way. How can we handle this data protection in a creative way? How can we reach data protection for everybody and keep the possibilities for competition for science and for research? This would be possible. It is possible, but we must allow for it, and we must take abreast the technological discussion. Now, Ms. Speaker, what do you think about the data protection handling? Yes, I think my point of view is slightly different. I would start from a technical point of view. We don't have, or we don't promote corresponding technology. I think the Corona app is a great app. It's a huge success. It's really an application for our freedom. And in China, you won't go anywhere if you don't have this app. And as a foreigner, you are constantly being yellow and you don't know why. So I think this Corona app is a huge success in Germany since we had this security, and the citizens got the impression if I download this app, it's great. Now it was a problem from the political point of view. Now we have the app, we have the digital vaccination passport. I am able to register at the restaurant with the Corona app, and now we see again that people use it more and more. And this is where I would be looking for creativity at the technology. Technology creates problems, but also proposes many possibilities to solve these problems. But therefore, to go this direction, we in Europe must really be aware of the possibilities, of the opportunities of this GDPR. Brazil is the pioneer country in South America. They imported the GDPR. Now in Silicon Valley, they also imported the GDPR. Then in the United States, we have many federal states that also want that kind of legislation. We have the Trade Commission that is now having their wake-up call. It's a kind of counterbalance regarding autocratic systems and general access to our data. And this is something where we should take technique on board in order to promote the third way, the third direction Europe is proposing. Okay, Mr. Voss, yeah, 1 minute before I ask the Commission. Yes, we always like to say that GDPR is a kind of great blueprint for the entire world. Of course, this is one point of view, but in the political world, in the Commission, we then have the problem that we don't continue to develop it, and this is an error. I think we can improve this regulation if we offer clearer structure, different possibilities, pseudonymization, anonymization, very important in the health sector. If we want to contact the patient later on, all these things are possible. We can think about the different models, but nothing happens. And this is due to this sacrosanct international law. And this is why we're not allowed to touch this law, to change this law. But it's not the right position regarding this regulation. I think we really have to think every evening what we can do better tomorrow. And this is something we are not doing regarding the GDPR. There is huge opposition at political, administrative level, where everybody says, no, we're doing great work, and we are aware of the fact that we can even become better. And this is what my critics are about.
Mr. Voss has been asking for a changement of the GDPR. Is this in the cards for the European Commission right now, where you're discussing the European health space? Are you planning to touch the GDPR to make it happen?
Yes, indeed, the GDPR is one of the also fundamental instruments that we look GDPR, like, for example, again, referring to the primary use of data, the right of portability. So in principle, it is a right of an EU citizen to be having access to their data and transferring their data, including their health data. However, we also see at the same time that there are some problems. For example, if this data should be given in digital form, that would be helping the individual, would be helping the citizen to be carrying them, especially when it comes to health data, how this data maybe would be placed, for example, in an electronic health record, how the different electronic health records could be interoperable within the EU. So these are all issues, or how, for example, data could be processed. Of course, there are some legal bases within the GDPR where data are allowed, health data are allowed to be processed for certain purposes. So the idea is to see what could be possibly a common legal base of processing data. And at the same time, of course, if we're creating a European health data space, one of the fundamental objectives of creating this European health data space is to also ensure and provide trust and confidence to the individuals as well as the researchers and those processing data, that this environment is GDPR protected, it provides security to the individual, how the data are collected, how they are processed, or if we're even talking about secondary use of data, it could be also involving that the data are not as such moving themselves, but they are protected in the sense that, for example, if you are developing an AI system, that the AI system is moving, the algorithm is moving in protected environments, in a federated learning, and without releasing the data, but the algorithm moving within those secure environments and being trained in those secure environments. So it's one of the important parts, I would say, of the European health data space, to ensure, on the one hand, the protection and privacy within this infrastructure, and on the other hand, to also possibly provide better clarification as to some elements of the GDPR which require further expansion and understanding and interpretability within the health context. As I said, for example, the right of portability, which in principle you may be given a bunch of documents or scans in physical format, but it might be more helpful if they were digitized, if you were given, if they could be transferred to you in another member state, if you wish them to be transferred. I think that will be also helping and the citizen and the patient and the freedoms, fundamental freedoms within the EU.
Thank you very much. Mich hat hier nochmal ein Hinweis erreicht.
One question or one hint from Mr. Peters. Those who have problem evaluating the data from Germany are, for instance, Belgium, people working in Germany and so on. But if I'm right, it's specifically about these questions. We will have the European Health Data Space that will touch upon these questions.
Right now, there's the regulation 883 out of 2004, where you can export or where you are able to take benefits from other member states, and you're able to go and see a doctor somewhere else. But the European Commission is like, you have the right to do this like generally, but apparently you're working also on a framework to be able to have the support of what you in fact need, like the portability also for the documents and so on. Maybe you could elaborate when citizens can hope for this kind of development.
Yeah, yes, indeed, you're right that there is the cross-border healthcare directive. If I'm not mistaken, this is what you referred to, because at some point I lost the sound. But there is the cross-border healthcare directive, which ensures indeed that the EU citizen could be moving within the EU, receiving services, healthcare services, and this has tremendously, I would say, helped the citizens and provided concrete benefits to the citizens. But indeed, as you said, that directive was adopted back some years ago, like 10, 15 years ago. So it was very much reflecting the needs of how things were at that time, which it was mainly an individual physically moving from one place to the other to receive, for example, medical services, medical treatments, and so on. Now, however, 10, 15 years after, we see this advancement in technologies, advancement and abundance of digitalization and digital data, which creates a new potential in how healthcare services are provided, in how, for example, maybe the patient and the citizen might need a quicker access to his or her data. And let's not forget also the systems which are already in place, like My Health at EDU, where there is already an infrastructure for e-prescriptions. So you may be in another member state now and requiring a prescription from your GP in another member state, and the GP in another member state could be prescribing and going to the pharmacy of the other member state and picking that prescription that you need to acquire in the other member state. So, and the same thing with patient summaries, actually this infrastructure. So we already have some, if you will, a pilot project of how things are working, and indeed also having to reflect to the new advancements in how healthcare services are provided, how technologies are evolving. Of course, we have a lot of digitalization also in products, in telemedicine, teleconsultations, telemonitorings, all these solutions now, which are becoming part in one way or another in our lives. Either, of course, a lot of these are medical devices, and of course, they are governed by different rules, but also for well-being. And again, it will be also another stream of our work to ensure that these systems also are of certain quality, are interoperable. There is questions, for example, on reimbursements. There is questions on interoperability of these systems, whether you are monitoring, you could be transferring data to your electronic health record. So exactly, basically it's how healthcare has changed drastically, I would say, in the last 5 to 10 years, and hence the need why the cross-border healthcare directive is also under revision by our colleagues also in DG SANTE, and hence also why the need for the European health data space, and of course combining this also with the proposed AI regulation, because they are all interrelated, all these issues. And the medical devices regulation and the new medical devices regulation, which has been adopted in 2017 and entered into application this month, actually, that last month actually, which also takes into account digital standalone software in healthcare and all these things. So these are all interlinked basically, and that's how we are looking at healthcare. Yeah.
Thank you very much. Wir haben jetzt viel gesprochen über.
Thank you. Thank you. We have been talking about every single person, the impact on every single person, but there should also be a huge impact on research. Miss Professor Spiecker, my question would be, will each single person feel something when these health data are being used? No. From an economical point of view, we have to say that these data can be used several times. It's not like a slice of bread. If somebody eats my slice of bread, then I'm lacking the slice of bread. If we share data, we can share them endlessly. And the problem is, if we share data, they are away. I can't get them back, and I can't control any misuse. And this is a very important question. If we look beyond, with these health data, we can do great things, no question. But there's also a huge potential for earning money, as there is for AI. And we don't have a regulatory framework regarding those who make available the resources, these data, and how they can also have a benefit from it. So research where results and methods are shared. Okay, we have many research in industry, in science. Okay, if we regard Google, if we regard Tesla, all these things happens behind the curtain, and we don't have access to it. So okay, and research is not always the same. If we are talking about cancer research, of course, everybody would say, okay, I would like to give my data, but these cancer research data are also being used by cosmetical companies, which is very useful, very interesting, since it can be used for interesting beauty products, okay? And this is what people don't want, saying, okay, when I gave my data for cancer research, I don't was thinking about beauty products, okay? And there I would like to come back to Mr. Voss. How will we react to this, okay? And every single person, or we are not in state to protect ourselves as an individual person. Okay, I have two questions from Miss Dr. Geisberger, TU Munich, Technical University Munich. We have the data, health data for research. Okay, if we only say it's earmarking regarding the scope of research, isn't this just too not enough, too imprecise? And then second question, if research is of public interest. First question. This is what I wanted to talk about regarding the research data management. And we have this within the GDPR. If I'm using data, I have to present a secure concept. And the more invasive I use this data, the more sure my security concepts must be to define who is allowed to have access. How can I show who had access? How can I follow if something has been changed? And then second question is, who will determine what is allowed from a general point of view? We are still at the beginning, since the GDPR is only giving some instructions. They say, okay, research must be possible, but not all research can be on the top of GDPR. It must be a kind of balance between research and data protection. Okay, finally, it will be the European Court of Justice, since it's the final decision competence. Except if the European legislator will define more in depth. If we are talking about the European health data space, the European legislator can become more precise. Nevertheless, the European legislator has to accept what the European Court of Justice says regarding data protection and the European Charter. Okay, and therefore, Ms. Geisberger, sorry for that. We still have to wait for a final answer. I am convinced from a legal point of view, when we are talking about patents, shared information, I think that there we can be talking about public research, and then we are able to define what is not public research, where we don't have access. We have lots of publications and scientific publications, but there's nothing regarding Google and Tesla, and we know why. Okay, thank you. Mr. Voss, the European legislator, will the European legislator define something regarding research? I'm not aware of this. We should ask the Commission about this. I'm not aware about this. Now, regarding European health data space, there maybe will be some limitations, but I would be happy if, regarding data digitization, we could start different topics in parallel. It's too easy in my point of view. Our current legislative structures, and we have our political fragmentation, we will not make progress. And therefore, I really would be happy would the Commission put more pressure on this topic, okay? And now, since you have been addressing the Commission,
ask the Commission to pump up the pressure. So the Commission has the last word, please.
When it comes to research, which is the second, let's say, stream of our work, of course, the basis for all this and the European health data space is very much the GDPR. Of course, the idea is that the GDPR should be and is protecting and should be protecting privacy and data and so on. It is also true that there is some issues which might require further interpretation or explanation. That's why we also have a joint action with the member states, which is now running, and it will be producing results in the next months. And one of the streams is also about data altruism, what the citizens understand data altruism, to what extent they would be willing to give their share their data, to whom, how they should be used, and so on. Of course, whatever is decided within these joint actions with the member states, because there is big projects now taking place also in that regard, the GDPR would be the foundations of everything. And of course, the case law of the court, and of course, how it's interpreted by the guidelines in this regard. Now, when it comes to also research, how it would be used for research data, it would be, of course, there is not only GDPR issues there for research. There is more obstacles. That a startup, for example, cannot use data now to innovate. How it could be used for boosting up, for example, AI in Europe, because they need data. The data have to be also connecting it with the proposed AI regulation. The data need to be of certain quality. They need to be diverse. They need to be they need to be correctly labeled. They need to be cleaned correctly. They need to be aggregated correctly. So there is obligations there, which are already now in proposed legislation, and somehow the European health data space could also aid in helping the startup, in helping the researcher, also fulfilling, if you may, the obligations under the proposed AI regulation. So at least, for example, they could be ensuring that they have diverse data within the EU, that the regulator, for example, when they're checking AI algorithms, could be checking that indeed the AI algorithm is performing equally well for the European citizen if it's coming, for example, from a third country. And if there is the data available, they would be able to check these things at the hospital level even, if indeed it's performing equally well as it performs, for example, in Asia. And that's why for research, for development, for ensuring also the trustability of the technology, that's why we have to have this data somewhere, that they would be organized somewhere, and different players within this chain could be using them for different purposes. And this is what we're also trying to do within the EHDS too.
Sie sehen, es ist ein Thema, über das sich viel sprechen lässt.
Yes, it's a huge topic. We could be talking 1 more hour about artificial intelligence, but we don't want to take your time any longer. I just want to tell you the next event of the Hessian state representation. It's after the election of Bulgaria on the 13th of July 2021. I thank you very much for your attention and wish you a pleasant day. Thank you.